Okay, so today we will be discussing section 2 of part 2, and it is fever. Fever has 3 chapters. Alterations in body temperature has 3 chapters. Fever is there are no much changes in fever other than just this one disease category that present with fever as cardinal signs. This is there, but in the previous one there used to be anti-inflammatory diseases with fever. Was the cardinal signs of fever was the table, but here the table is different. That disease categories that present with fever as a cardinal sign, and it includes infectious diseases, autoimmune and non-infectious inflammatory diseases. And earlier it used to be auto-inflammatory disease in which fever is characteristic. So that 15.1 table is replaced by 18.1 table, which is a little different, and you need to go through that table. Other than that, laboratory tests and all are same. And fever and rash, as usual, there is little more of COVID-19 added everywhere, like centrally distributed maculopapular eruptions. COVID-19 is added, and peripheral eruptions they have added this is peripheral eruptions. In that one they have added a COVID-19 big square is there, so you can read it upon about COVID-19 in that one. And again they have added COVID-19 in vesiculobullous or pustular eruptions. At these 3 places they have COVID-19. In urticaria like eruptions also COVID-19 is added. And there are many figures in this chapter, PU, Paraxia of unknown origin and fever of unknown origin. So you would have to go through them. Very important. Fever and rash. In the chapter of fever and rash, there are many images like centrally distributed maculopapular eruption on the trunk in a patient with measles, and then this peripheral eruption on the wrist and palm in Rocky Mountain spotted fever. This is discomative eruption in Staphylococcus scalded skin eruption. Vesicular and pustular lesions on the chest in a patient of varicella. Very articular eruptions. Nodular eruption in disseminated cryptococcus, and purpura fulminans in acute meningitis. These were all there in the separate chapters. They have been taken and given in a particular single chapter. So tick bite fever, you can see the image. And in next chapter, the fever of unknown origin, there is the criteria defined as follows. The 4 points are same, but below that is closely related to FEO is inflammation of unknown origin, which has the same definition of FEO except for body temperature criteria. The inflammation of unknown origin is defined as the presence of elevated inflammatory parameters on multiple occasions for a period of at least 3 weeks in an immunocompetent patient with normal body temperature, for which a final explanation is lacking despite having history, physical examination and obligatory tests listed above. So this is about IUO, which is not given in the earlier edition. So IUO is an extra one. And etiology and epidemiology also, you would have to see some differences are there. Roughly comparable to 60 years ago, they have given that tuberculosis is common in the Western, other than outside Western nations, and in Western nations still the non-infectious inflammatory diseases are common. There are some new points added there. You have to read it. But upon that there was some table which was different in the previous edition, 20th edition. There was etiology of unknown according to some studies. But here they have divided from 1999 to 2019 and divided according to the areas, like geographic areas. And everywhere it is similar, like infections are common, and but in malignancy is a little more common in Asia. So we have to go through this table 20.1 in the 21st edition. And apart from that, approach is same. Only thing is that here the microbiological serology should not be included in the diagnostic workup of patients without PDCs for specific infections. A tuberculin test or interferon gamma releases say just IgRA, quantiferon test, which was not there in the earlier edition. This quantiferon test is included in the obligatory investigations. So obligatory investigation is quantiferon test is also added. Other than that, everything else appears to be same. And here also it appears to be same. And here in the investigation part, there are some differences like the FDG PET and diagnostic criteria, and other than that, the conventional scintigraphy imaging other than PET CT, they have been changed a lot. You have to go through this whole paragraph of PU, the Paraxia of unknown origin investigation part, that is FDG PET and conventional scintigraphy imaging other than PET. So I will be making some MCQs upon this also, so that you will come to know how the difference is. And treatment part is same, interleukin 1 inhibition. Earlier in the previous edition they have given treatment part as directly anakinra was given, but here they have given interleukin 1 inhibition. So maybe there are many blockers other than anakinra also. So they have given here anakinra 1 inhibition or interleukin 1 inhibition. And prognosis also they have changed. The prognosis paragraph is different than when compared to the previous one. So this completes the section 2 of part 2. Next section will be section 3 of part 2, that is neurological system dysfunction. We'll be discussing